Well, let's start the news. The Member of Parliament for Bung Katamanso Ni Laya Fotiagbo says he does not believe in the inclusion of party militias in providing security in Ghana. According to the former Greater Accra Minister, politicians must join forces to disband the services of party militias because they have nothing good to offer the country. Mr. Fotiagbo says if the Commission of Inquiry into the Ayawaso West Wogon violence outcome is fair, it will help disband vigilantes in the country.
Those who have been put on the commission are very eloquent people who have good records in this, good track record in this country. We all have respect for all of them because some of us met them when we were very young, and we don't have the doubt at all in our minds that they can do something good. Until they fail to do, or they fail everybody, then we will know whether they've changed their attitudes or whether they've changed or what we have known them for is still what they are. So I have the confidence as an individual that through their efforts and the sitting, this vigilantism will come to an end, because some of us do not believe in it. I've been a member of parliament for 4 terms, for almost 60 years in this country. I've never relied and used any vigilantism or any macho man or any landguard to do anything for me. And when I was also a regional minister, we did not rely on any vigilantism or any macho man to come and do anything extraordinary for us. The most important thing is that as a politician, you must make sure that things are done well. The people are given the needed respect and recognition and the needed relief that they need, and the development that they need in the catchment areas. With that, you will not be found wanted. Vigilantism will not do anything for a politician. So we should not rely on it.
Now, government has with immediate effect placed an indefinite ban on the harvesting, salvaging and transportation of rosewood across the country. Already issued permits for salvaging and harvesting of rosewood have also been revoked, describing the felling of rosewood as a national security threat. The Lands and Natural Resources Minister Kweku Asuma-Treme warned of dire consequences if urgent steps are not taken to address the menace, and has therefore directed regional and district security councils to handle it at their level. The ban follows a JoyNews hotline documentary, Killing Our Roses.
I wish to state that harvesting of rosewood is illegal in any part of this country. Similarly, the transportation and export of rosewood is suspended with immediate effect. Note that salvage permits were issued only for the evacuation of lion logs. Any fresh harvesting of rosewood tree is illegal and must be reported for immediate arrest of the culprits. 2. The Forestry Commission is hereby directed to suspend the issuance and processing of CITES permits for the export of rosewood. 3. The rosewood menace has become a national security threat, and I therefore appeal to all RISEC, DISEC, in the northern sector, opinion leaders, Ghana Police Service and Customs Division, the press, and the general public to support the ministry in our effort to regulate the exploitation of natural resources of this country.
Let's move on. And the Vice President, Dr. Alhaji Mahmudu Bawumia, has charged governments on the African continent to actively involve health experts during decision-making in the health sector in order to have the desired impact in their countries. He also urged the continent to expedite action on policies geared towards cutting down on infant mortality. Dr. Bawumia, who was delivering the keynote address to officially open the African Health Economics and Policy Association on Monday, also encouraged other African countries and also touted Ghana's ambitious move to deliver medical supplies by drone, a policy he says will take off later this month.
The Sustainable Development Goals for infant mortality by 2030 is 12 deaths per 1,000 live births, and that for under 5 mortality is 25 per 1,000 live births. We need to double up our steps if we are to cut infant mortality by nearly 64% and under 5 mortality by nearly 50% to meet the SDG targets. How to do this cannot be left to medical practitioners alone. We need a multidisciplinary approach in thinking about and finding solutions to these challenges. The need to step up our efforts to improve the health of our population requires increased investment in all facets of health. Primary healthcare performance improvement country data profile shows that spending on universal health coverage by most African countries falls below 50% of the global benchmark.
Now, a member of the Council of State, Sam Okudzeto, wants government to end talk shops on banning plastics and bite the bullets by implementing the ban. He says if plastic pollution is not checked, it would continue to negatively impact the environment. Speaking at the commemoration of this year's Commonwealth Day celebrations, Mr. Okudzeto said Ghana must take sanitation lessons from Rwanda. Efwa Evans Chinri reports.
Children from various basic schools in Accra are debating the use of plastics and why it must be banned.
The 38th of Jamaica is invited to join this meeting to discuss and make the case against the issue of banning plastic bottles across all schools for Commonwealth nations.
The motion sets before this House. Plastic bottles must be banned across schools in the Commonwealth. The current president of Nigeria.
A member of the Council of State, Sam Okudzeto, who was very impressed with the debate, says Ghana must move beyond mere talking and learn from a country like Rwanda when it comes to issues bordering on sanitation.
Our own president said that Ghana is going to be the cleanest country in Africa. And I think you heard the delegate of Rwanda. I think you all heard the delegate of Rwanda. I still have not had the opportunity of going to Rwanda. My daughter has been there. Many of my very close friends and associates have been there. And they have affirmed what she said. That indeed it is the cleanest city on the continent of Africa. Now, how did that happen? I think it just shows that where there's a political will, there is also a way. Where there is a political will, there is what? There's always a way. I think in Ghana we spend all our times debate, argue, and sometimes we take it into physical. But I can assure you, no nation has ever progressed with that kind of atmosphere.
Ian Walker is the British High Commissioner to Ghana. He says the ban on plastics must be considered.
We made very clear commitments to programmes that are now going to be, as I think it was the Prime Minister of Canada said in the last debate, about how do you find alternatives. So instead of just banning plastic, you can find better investable ways to make plastics more reusable in different bits of society. The work of the Royal Commonwealth Society, the work of the Commonwealth Human Rights Initiative too, I think is instrumental. Why? Because it's about things that we actually care about. They're not some distant, strange things that we politicians often talk about. These are real things that matter to real people on the ground. And the thing about the Commonwealth, for me, is that it's a grassroots organisation. It's much less about always having heads of government meetings and much more about grassroots organisations helping each other and the people-to-people links that has created.
The theme for this year's celebration is a connected Commonwealth, which offers opportunities for the people, government and institutions of these nations to connect and work together.
Well, before we go, this one will intrigue you. We all know the edible white clay known in Akana as Inshere apparently has cancer-causing agents. And that's an outcome of a study by scientists at the Kwame Nkrumah University of Science and Technology. Well, they found levels of lead and other heavy metals more than 3 times the required daily intake for a normal human being who is an adult. Love FM's Kwesi Deborah has been speaking with Dr. Marian Asante-Wankansa of the Department of Chemistry on the findings.
I'm at Sharifa Haroon's residence at Old Tafo at about 5:30 p.m. as she nibbles on a second pack of white clay. The 26-year-old consumes about 40 grams or averagely a handful of white clay daily. I buy 50 pesos to 1 cedi of white clay every day, she says. After consuming it, I drink water and I'm full and happy. Consumption of clay, especially by children and pregnant women, has been reported in several countries across Africa and other continents. Studies have confirmed the phenomenon in Cameroon, Congo and Nigeria, as well as parts of India, China and Philippines. There are several reports in parts of the Americas. Prevalence on pica is very difficult to obtain because 1, there are differences in the definition, and 2, patients are reluctant to come out. But according to a 2016 report published in the International Journal of Gynecology and Obstetrics, Africa has the most prevalence of 44.8%, followed by South and North America with 23%, and Eurasia with 17.5%. Nutritional, religious, cultural, and even psychological, among other reasons, have been linked to the habit. Dr. Daniel Fojo is a psychiatrist at the Konfanochi Teaching Hospital.
You can classify pica as an eating disorder, but we define it basically as compulsive eating of things or substances that do not have any nutritional value, or they are not necessarily edible.
A 2013 study indicates 28% of women of reproductive age in Ghana eat averagely 70 grams of clay daily. Benefits of white clay are said to include ability to absorb dietary and bacterial toxins associated with digestive tract disturbance. However, in 2014, researchers in Johannesburg, South Africa, found pregnant women who eat clay are at risk of anemia and other health conditions.
We always say that there isn't actually a really known cause to it, but we have found that a lot of people that have reported it, we find that they have some deficiencies, nutritional deficiencies, and that's what actually motivates them to eat those substances. So deficiencies like iron deficiency, zinc deficiency, they tend to be eaten to supplement that particular deficiency they have.
Dr. Asante-Wankansa has been researching into metals in white clay on the market.
Children are the next generation and women are the bearers of the next generation. So everything that affects women and children is a matter of global importance. And because pregnant women in particular in Ghana, almost of all ages and educational backgrounds, find themselves eating this clay during pregnancy, I thought it was interesting to find out what it contains, and since I'm a chemist, I went to look for the chemicals that might be present.
For the study, she randomly obtained 30 pieces of baked, ready-to-eat white clay samples from 10 markets in Kumasi metropolis.
Now, metals are a group of compounds. To the layman, let me say some chemicals, and these could be essential or toxic. So we found some essential metals like calcium, potassium, iron, and zinc, which are useful for the body's function and growth.
Toxic metals like lead and arsenic were also detected.
Lead and arsenic are known carcinogens, meaning they have the potential to cause cancer when humans are exposed to it. It doesn't mean everybody who eats the clay will have cancer in their lifetime, but it's been associated with cancer. Yes, the levels of lead and cadmium were above the permitted daily intake. So we assume that every pregnant woman takes 30 grams of clay a day. And with that, there's a formula that is used in the calculation. And with reference to the levels we obtained from the clay, factoring in the assumption that every woman takes 30 grams a day and per their body weight, which are all standards, the levels are quite high and worrying.
Reporting for JoyNews, Kwesi Deborah.
And that'll be it for the latest news update. And this one is interesting. Did you take any when you were pregnant? Or?
No. I think it's just things that you maybe yearn for when you're pregnant. There are things that some people say they have no control over. So, you know, for instance, some people would go to the fuel station. They just want to smell the fuel, you know, the petrol.
I've heard of one before. I don't know whether it's true. I think I need to confirm the next time you're pregnant with you.
It's unique.
It's about eating dried feces. You've heard that one before?
I have, but I didn't feel for that.
I just can't imagine you.
It's not the same for every person. I mean, Roland, stop it. It's too early. That's it for the news for now. There's more news. We will come back with the newspapers, and we will definitely hit myjoyonline.com as well. Stay with us here on the AM show.
I'll be right back.